Okay. Good morning. Welcome to our first ever virtual membership meeting. With me today is Michael Scherneck, the President and CEO of the Southeast Georgia Health Systems Hospital. I'd like to ask everyone who's joining, if you are joining with an iPhone or attending with an iPhone, make sure that your name is displayed. So there is a function in Zoom that you're able to identify yourself. And the reason why we're asking you to do that is because we will have a special gift for those who have attended this meeting. And so I'd like to call this meeting to order. Right now I would like to ask Len Hoschel to lead us in an invocation and the Pledge of Allegiance. Len?
Okay, all right. I have no idea how much of that got out there, but the fact of the matter is this is very important. I hope you will go forth and tell everybody what a good meeting this was, and let's force the Board of Realtors into buying the big Zoom package for our next meeting. I think that would be so excellent. I think it would be incumbent for all of us to, even though we rise in respect to the good Lord and stay in a vertical position, if you would, for the pledge to the flag in just a moment. Almighty God, we are in trying and troubling times. This unfortunate virus has touched all of us in some shape, form, or fashion. Whether we've actually had the virus or not, we are all succumbing to a new way of living in life and relationships. I pray that we will come through this in unison and to everyone's benefit. We are so blessed to have public officials such as the hospital and the hospital crew and all of our public servants who put themselves on the front lines for us daily. Thank you, Lord, for this protection, and bless them and keep them. I would also be grateful for the fact that even in these very, very trying times, we've been very successful, and thank you for that blessing. Lord, look upon us with favor when I speak to our best and most wonderful resource in this country, and that would be our children. I pray that you will take care of them, not let them get behind, but keep them up to date and let them proceed in life as well. In closing, Lord, I ask that we all remember to go forth and sow your seeds, be it on rough, turbulent ground or on fertile ground. In any event, make an impression and be a sphere of influence for you. In the precious name of our Lord and Savior, Jesus Christ, I do say amen. Now, again, I hope that you are standing, and to that, we are going to recite the pledge in unison. I pledge my allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all so much for this privilege.
Thank you so much for that, Len. That was beautiful, and that was just what we needed to hear this morning. Well, with me today is Mr. Michael Scherneck, who is the President and CEO of the Southeast Georgia Health System. And I'm going to read a little bit about his background, and then I'm going to ask him to introduce a little bit more about himself. Mr. Scherneck moved to the Golden Isles in 2003 to assume the role of Executive Vice President and Chief Financial Officer for the Southeast Georgia Health System. In August 2015, the Board of Directors of the Southeast Georgia Health System appointed Mr. Scherneck as President and Chief Executive Officer. Mr. Scherneck also serves as the President of Cooperative Healthcare Services, which operates a number of employed physician practices throughout the health system service area. Welcome, Mr. Scherneck. Thank you so much for joining us today.
Thank you, Allison. I appreciate the opportunity to be here. As Allison said, I've been here now for about 16 years. My wife, Kathy, and I have moved over we're over at Oak Grove Island, and really have enjoyed where we are. We have a son who lives over on the island who works at the hospital as well, a little nepotism there. But I also have a son up in Hilton Head, and then have a daughter and a son-in-law and grandchildren up in Wilmington, Delaware. And like probably so many of us, it's pretty hard to be able to travel right now. So we haven't seen them since Christmas, and we're looking forward to the opportunity to be able to get up there sometime sooner than later. We've had to cancel a couple trips already, but you know, again, the virus certainly has had its impact in so many ways, and certainly that's one of the key ways that unfortunately so many of us are affected by not being able to see some of our own family members. So, but we're happy to be here and certainly can speak a lot about what's going on here at the health system. You know, I was explaining earlier today, we have 75 patients, inpatients in our hospital suffering from coronavirus. So, you know, 6 weeks ago, that was probably 5 patients. So the numbers certainly have changed pretty dramatically, and it's really kind of found its way throughout our community. And I guess, again, we'll talk a little bit about a couple of the issues along the way. But in spite of what some people would like to think, this really is not much of a hoax. And maybe some of you have already suffered through it, and some are asymptomatic and some are not. But those that get it can get it really pretty seriously. So we really need to keep our guards up against this really deadly disease, frankly.
Thank you for that. And again, welcome. And hopefully we're going to have some time at the end of our discussion to ask Mr. Scherneck some questions from the group. And I'd like to ask you to to direct any questions that you have via the chat function, which will be found at the bottom of your screen. And Tony will gather all those questions, and we'll make sure, hopefully Mr. Scherneck will have time to answer a few of them. I've got a few questions that I've prepared this morning, and I'd like to speak a little bit about, you know, COVID-19 as it relates to our real estate business. And, you know, as you know, when Len mentioned it earlier, we've been working in a hot market since the beginning of May. And we've received great support and information from the National Association of Realtors and the Georgia Association of Realtors in terms of real estate best practices, like the use of personal protective equipment when we're showing property, working with clients. We've been limiting in-person meetings or holding virtual meetings like this one, and following safe practices in our board and brokerage offices. When you think about a typical day in the realtor's life and as we go about our business, where do you think that we need to be most vigilant?
I think, you know, I think about some of the things where if it's a smaller group, I think those are pretty easily managed or a little more easily managed. I think the first problem you have is sometimes trying to overcome the understanding and the appreciation that some of the customers, some of the folks you're going to have, some of the buyers or the sellers are going to have with respect to, you know, just what needs to be done. I think if you're coming in on a, you know, a smaller group basis, it's a little easier to be able to have that kind of social distancing, because really, you know, there's been a lot said about social distancing. There's been a lot said about masking. Those are the kind of things I think that people really need to be vigilant about when you're going through, especially when you're going into somebody's home. I mean, I think you want to make sure you're protecting the potential buyer. You want to protect the potential seller. And of course, you want to protect yourselves. So I think that the things that we've talked about in the past, making sure that people are wearing masks, making sure that, again, there's a lot that has been said recently, whether, you know, does a virus remain on surfaces or not. It certainly doesn't hurt to have clean hands and to be able to sanitize hands, and frankly, to use, you know, wipes along the way. But and sometimes it's a little harder to have some of that social distancing as you get into some tight spaces. But as long as it's not, you know, really prolonged close contact, that's really the CDC catchphrase. And that's basically staying within 6 feet of somebody for more than 15 minutes. So I think if you try to maintain those kind of separations, I think you're really probably, you know, well off. That's on the individual kind of, you know, showings. But I guess if you have an open house, that's really when I think it's probably a little more problematic, because, you know, you don't know what practices people have had. As I said, trying to overcome some of the perspective that some people think this is maybe just a hoax of some sort. As I say, you know, I can tell you firsthand it's not. But you know, I think if you can somehow manage those expectations and try to help the people, you know, be respectful of one another and be respectful of the people whose home they're walking into. It's just not you know, it's not just you that we're talking about. So please make sure that we're taking care of the people and being respectful of everyone at this stage. And remember, again, the mask that we're putting on today is not to protect me as much as it is to protect you.
Great. Well, thank you so much for that. You know, there's a lot of numbers associated with the news about this virus. And one of my go-to places has been the Weather Channel. They provide an interactive virus tracker that looks at county data throughout the country. And currently, they're reporting approximately 24.46 cases per 1,000 in Glynn County. And what does that mean in terms of day-to-day activities? If I go to the beach and see 100 people, does that mean that 2 of them could have coronavirus?
Allison, the data, and I think that's an interesting way to different people look at different things. Again, I was the chief financial officer, so numbers used to be my life and still are in many respects. But the 23 to 24 people right now, that's really how many people per 1,000 have contracted the virus over the course of time, since March. One of the things we look at on a daily basis is just how many people have contracted over the average of the last 7 days. And right now in Glynn County, that number is 45. And when you then reduce it based on 86,000 people, that's less than 1 person per day getting it. But again, while that might be small numbers, and certainly so many of us know someone who had it that was asymptomatic, that's great. But at the end of the day, there are some folks who it's not going to be asymptomatic, or they're going to be pre-symptomatic and they're going to develop. So, we keep looking at the trends. It did peak a little bit and it's starting to come down, but it's sort of leveling off again right now to around that 40 to 50 per day are getting it in our community. And I think those are the things we really need to be sensitive to, because again, it might not necessarily be problematic for 1 person. The reality is there's going to be people, and it's when it finds its way in, it finds its way throughout. I was talking a little earlier before the meeting, talking about the fact that we've had in our Brunswick campus, we've had a mother, a daughter, and a granddaughter who all were in the hospital. And unfortunately, one of them didn't survive. And down in Camden, we had the same thing happen. We had a threesome there, and unfortunately, one of those folks passed away as well. So it really can find its way to many of us, as I say, are asymptomatic, but really be careful about it because you just don't know what those numbers could end up being. And sadly, across throughout the state, I think the mortality rate is 2.1%. So, across the state, 2% of the people who get this are going to have passed away, which is incredible. Early on, a lot of it was in nursing homes, but as I say, right now, that's not necessarily the case.
Thank you. If someone is living with someone who has tested positive for coronavirus, yet they themselves have not tested positive, should that person quarantine at home for a period of time, or should they be going about their normal activities?
Allison, that's really a good question. I think that it's really a question that maybe it's easy to answer, but the answer is hard to swallow. Right now, the CDC has basically said if you live with someone and they've contracted the coronavirus, you really should quarantine yourself. They should isolate, and you should quarantine yourself for 14 days, that's the piece that I think makes it pretty difficult. 14 days from the day that they first started to show symptoms. So, we'll talk a little bit maybe about testing, but sometimes the test results are taking long enough that, by the time you find out the test results, you're already halfway through your course of 14 days. But that's really the problems. That when we get home, that's probably when we let our guards down. We take our masks off. We're not social distancing. And sadly, when you think about some of this, there's stories about, camps for youngsters where the youngsters basically brought it home and kind of shared it among the family. And, you have a whole household that's basically been affected by it. But, if it's really important, again, to have that quarantining, to be able to make sure that you can kind of keep separated. Now, the thing about it, if you do have a family member who tests positive, some of the guidance right now is basically you only have to wait 5 days before you get tested, because it sometimes will take that long for the virus to show up in you. Even though you might have it, it might take 5 days for it to show up. So it's almost pointless. When we have somebody who gets an exposure someplace at the hospital is worried about it, there's no point in testing them right away. We really need to wait a little bit to give the virus a chance to settle in and have that done. Also, we're finding now that the virus, even after it's done, after it's dead, it will still appear in somebody's test. So that, there's some changes going on right now about whether, the idea of let's get 2 negatives after somebody's tested positive, that could take a long time because the virus that you're measuring isn't necessarily a live virus anymore. It's a virus that has since passed, but still resides in the test area. So,
all very interesting. And then we're talking about tests. Are all coronavirus tests created equal? If someone wanted to be tested, Is there a best test available locally? I know that some people are getting results back in 24 hours.
Yeah,
I know.
the testing has certainly been an issue throughout the state, throughout the country, and certainly our region's no different. I can just talk a little bit about it. I think that the providers throughout the community really have selected probably what are amount to be the best quality tests going. The problem really becomes the issue of the turnaround time. And just to give you an idea, at the hospital, we have a test that we can get done and we can turn it around in an hour. And every week we get 60 test kits, and we have to use 2 of them to quality control the unit, the device. So basically we have 58 to last us an entire 7-day week. So that's kind of been a problem, but we try to save those and hold those off for the people that really are the most potentially ill folks. We also have another piece of equipment that allows us to test several, of course, throughout the course of the day, and that takes about a 4 or 5 hour. But even there's a little piece of it, when you watch some of this, CSI kind of shows, there's little pipettes that they use to test labs, specimens. They're made in Switzerland, and guess what? We don't have any, and we can't get any until sometime in August. So we have to kind of almost ration the number of tests we're doing there, which again can be turned around in 4 or 5 days, which is great. We've also, outsourced, and right now we're using Quest, the national laboratory. They're turning tests around in just about 3 days or so, sometimes a little bit longer, sometimes a little bit shorter. But that's been a real problem. Even at the state level, they use a laboratory in Atlanta called Ipsum, and now they've also just added another called Mako to be able to help turn around their tests quicker. And I know you can get tested at the Department of Health, whether you're asymptomatic or not. They made some changes, and some people might find it to be a little bit disruptive, but it's probably a lot less disruptive than it was early on. Because early on, people would get there by 8 o'clock, and if you got there at 8:05, even if they were going to test till 1 o'clock, you had to turn people away because they had cars and cars that were there to be able to get tested. So they've made it so you now have to call to get it set up a time. Again, it might seem a little bit more difficult, but frankly, it's probably a lot better because you can schedule around it instead of wasting 4 hours of your time sitting in a line. If you have a doctor's order at our Glen Immediate Care, you can get it tested there. There's a way that's kind of just a drive up and drive through. Certainly our emergency rooms have it, but that's just, we would like to think that people who are really symptomatic would be the ones using the emergency room, because even if you're asymptomatic, it's not like we put you at the front of the line. You're basically going to wait your turn, and the extra people there are just going to require more. It's going to add to the wait times in our ER. We have the immediate care centers, other urgent care centers. They're all using their own little sources, but you might even want to check with them because sometimes they have limited capacity because of the supply issues. So it's really been interesting that just how long it can take to get some of these things. But I think we have a lot of options, but unfortunately, not all those options are the best. And again, the idea of the wait time. If you have to wait 7 days to get your results, and we had that happen at our own immediate care center not too long ago, we had to change the commercial lab we were using. Because after 7, you have to wait 7 days. You're already through your, by then you're feeling better, in many cases. So that's been a real issue, and I wish there was an easy answer for that, but I don't see that, being a really a swift fix right now. Unfortunately, we're just going to have to kind of plot ahead.
Okay. All right. Speaking of plotting ahead, this is not the softball question. When will this pandemic be over, and what should we be doing to end it sooner?
I think when we wake up from this dream, that's when it'll be over. Unfortunately, this thing, there's no way that this is going to be over before the vaccine, appear. And, that really, unfortunately, can be several months from now. So that's really, I think, the biggest issue that we have is there's just no certainty. And remember, I think that we when we first started getting into this, we were trying to flatten the curve. And the whole purpose of flattening the curve wasn't to make this thing go away. And I think that that's unfortunately sometimes the message I hear. This is not going to go away just because we mask up or because we socially distance. It's going to keep it. And frankly, we're able to take care of patients better now than we would have been back in March because there's been tested, whether it's the way we're treating patients, there's drugs that have kind of surfaced that are better off to treat patients. So the whole purpose was to flatten the curve, not to make it just disappear. So I think that that's kind of the reality. In fact, again, I think as long as you practice the masking, and I know, again, people find it's offensive in some ways. It really isn't. I mean, it's going to get the job done. Social distancing using hands, wipes, those kind of, hand sanitizers, washing hands, those are the kind of things. And, the thing I kind of worry about, is just people, when I think about people commenting about beaches, I know you can take a photograph that makes it look like people are on top of each other on the beach. And maybe in some cases they are, but if you walk down the beach, oftentimes you find yourself 6, 10, 20 feet from somebody and it just looks closer. I've seen some place where they actually kind of drew a 6-foot, square around their little, their chairs. And I thought, well, that's a good idea. That way you have people know not to get into your space. But I think we really need to try to continue to practice some of these things just to be able to help keep some level of normalcy in our life and to be able to help support the businesses that really are struggling right now. And we need to do what we can to kind of support them, but to support them safely.
Really appreciate that. Okay, so now I'm going to switch gears a little bit because we've been talking about the great work that the hospital has been doing, and saw an article earlier this week about the expansion that's being done. Is there anything that you would like the realtors to know that they may be able to promote to people, especially those who are just moving to the area and are trying to get to know a little bit more about the area and the services that are available?
Well, thank you, Allison. The article, the reason I think the article showed up there was we're actually trying to accelerate opening one of our floors in that new building. In fact, we expect on Monday to have a portion of that floor open for use for patients, because we have, as I said, 75 patients throughout our Brunswick and Camden campuses with COVID. We need to have more areas to take care of other non-COVID patients. So, our board has really, and again, to understand, our board is made up of people from Glynn County, McIntosh County, Camden County. We have physicians in addition to community, general community members. They've been extremely supportive, and they really have some foresight looking into the future. The project you see on Parkwood, that's roughly about a $140 million project that we're in the midst of. So we're really, I couldn't be more happy with how they've supported us. But they're also busy, and again, I think sometimes people, if you think about the number of physicians, for example, that have been recruited into our community, many times that's being done by the hospital with the support of our board of directors. So we are actually employed, but we're the ones who are helping to recruit and bring those folks in. They're also really supportive of our team members. But I think, we're really set up to take care of, the fundamental needs that you might have from a medical standpoint. Certainly there's some tertiary services we're just not capable of doing. And we don't, there's just not enough of us. When you think of our entire service area, and I kind of always describe that, I think from a Florida border, north 60 miles and inland 30 miles, 1,800 square miles, and we have probably 250,000 people. I kind of smile when I think back. I worked at Germantown Hospital in Philadelphia, and I drove through 7 neighborhoods, past 7 hospitals to get to where I worked at the time. So we're different, but we're different in that, in a good way. That movie 6 Degrees of Separation, we're kind of like 1 degree of separation. But I always sit there and say, if you don't know who you're talking to, I guarantee you know somebody who knows that person. And I think that's a huge advantage for us as a care organization to be able to know that. It's a lot, it's a little more meaningful when you're taking care of somebody you really know, or somebody knows, and maybe you have a little different perspective on it. But I think I couldn't be prouder of our team. They've stepped up, again, you think about coming to work, and it's the nurses and doctors certainly, but it's even, we have, when I came in here, Tony took my little temperature here to make sure we have 35 people committed to basically screening patients, or patients and team members coming through the door. So it's a huge commitment right now to make sure that things continue to function as they are. And I'd like to think, that it's working well. I'm a little disappointed, I guess, that, that because of the virus, we really have had to limit visitation. And nothing worse than being sick and not having a family member be able to come see you, or worse yet, somebody who's getting worsening and not have a family member, or to be that family member and not be able to look in on your loved one. It really is disappointing that that's where it is. And unfortunately, I don't see that getting any relief in the very near future. We are trying to do different things over at our skilled care facilities to be able to allow for people to visit there. But even there, it's a little bit more difficult, just given the people that have a chance of getting sick somehow, given what's going on. So it's the things that we'll look for when you're out there, though. They just did a study, and interesting because we just had decided this the day before the study came out, or the study results came out. But basically, look for people if they have a cough, if you have shortness of breath and fever. Those are the three key things that seem to be pretty common among the people who really start to, worsen. So, certainly some of those on their own, it's like, well, I have asthma, I have allergies, I have migraine headaches. Well, we really kind of said, look, don't just measure it based on one of those things. Try to look at the entire thing. And if somebody has multiple symptoms and one of them is cough, fever, or shortness of breath, that's when somebody needs to really take some steps to make sure that they're looked at, to make sure they're tested, and to make sure they basically can protect the rest of the folks that they interact with on a regular basis.
Right. That's a lot of information and very, very, very helpful. And, when you have the information, you can work through any problem.
As I said earlier, we're really fortunate. We have some great infectious disease physicians that bring some skill sets. We've been working regularly. Dr. Stephen Mosher has been part of the team that we work with literally on a daily basis. We've been kind of keeping up calls every day, 7 days a week, and we've added some middle of the day calls to make sure that we know what's happening in our community and what's happening in our hospitals. So there's a lot going on. And unfortunately, it's not going to go away, but I really think there are ways to help manage this so we can still continue to enjoy. We were fortunate a couple of weeks ago. We had the governor here, and we actually had the Surgeon General, the Vice Admiral Jerome Adams was here talking about it, and it was a great presentation, a great message. I just hope people really take that message to heart. So again, wear your masks.
Thank you. Do we have any questions? Okay. Okay. All right.
Oh, okay. We have time.
Sure. If there's any
Okay.
questions, I'm happy
Okay.
to try to answer them.
We
as
do
best
have
I
some
can.
time for some questions. Again, if you look down at the bottom of your screen, there's a little, right in the middle, there's a little chat button. If you click on that, a little window should pop up and you should be able to type in any question that you might have. But we've definitely been given a lot of information this morning. Okay. There is a question that we have. Approximately how many doctors and staff have tested positive?
That's a good question. We have about 3,000 team members through our health system. At this stage, we've had about 150 of them test positive. However, very few of them have been testing positive because of exposures at the hospital. Most everyone's been getting exposed either out in the community or at home. And again, once you have one person share it at home, it goes through the place like wildfire. Right now, we have about 55 or 58 people that are out of work because they tested positive for coronavirus. And that is an issue for us because, again, we count on having our staff available. In fact, what we're doing right now is we're arranging for agency nurses to be brought in to be able to help supplement this in anticipation of the census remaining at these higher levels. Again, higher than what we had been expecting, higher than what we've been running, but fortunately not as high as some of the other areas throughout the state and throughout the country. So we'll keep our fingers crossed, but we continue to try to urge our team members, please, we need to be the ones, again, kind of setting the example. And I guess to the extent that any of us can set an example like that, it's not all that difficult at the end of the day. You kind of get used to it and, just do it because, again, it's there to help everyone.
Right.
I guess that would be. I'm sorry.
Okay.
The question
Yeah.
was if you have if you have those symptoms, but you feel sort of okay. I'm not sure how you feel okay if you have a fever and if you have a cough. I'm not sure how that would be the case necessarily. But to the extent you have that, I would actually recommend that you be tested, so at least for a fact if you have it or not. As I said, you can very easily get your doctor to write an order. And if you show up at Glen Immediate Care with a doctor's order, there's kind of a drive-through there that they'll be able to help arrange for you to get tested and get the results back within a couple of days. And it's just nice to know that in the event, you do end up having, and again, frankly, if you have some of those symptoms and it's not COVID, you might want to know what it is. So, there's another reason why you might want to try to find out what's going on. But that really is difficult trying to, again, sift through these symptoms, because the list of symptoms started out with, 3 or 4 things, and now it's, there's loss of, sense of smell and taste. You feel fatigued. I said every day I look at that list. If I don't wake up with one of those, then I just didn't wake up, I think, is my problem. I think that those are very common symptoms, unfortunately, but along with everything else combined, it's important to look at the broader picture and how you feel. And again, understanding who you might expose if you are sick. It'd be nice to know for sure whether or not you have it.
Robert Jurgers asks, when there is a vaccine available, how much supply do you think will come to our area?
The question was about this, again, the number of vaccines that will be available. I've been listening. I think I heard somebody say that there are as many as 200 companies trying to develop some form of a vaccine. Obviously, there's only going to be a handful of those that are ultimately going to be successful and be able to produce it in mass quantities. I think that it's, who knows exactly how many of those will be available, but I think that they will try to make enough. I've heard some companies thinking they can produce 100 million. Well, that's great, but when you have 300 million Americans, it's pretty hard to say that 100 million is going to go a long way. So it is going to require several of these companies to be successful, and it's going to take some time. And I wouldn't be surprised if we find out, even if they were successful by the end of the calendar year, you still could find yourself 6 months and 9 months beyond that before everybody gets tested. I'm a little worried that people, don't forget, pretty soon we're going to be coming upon the regular flu season. And, we actually, with our own team members, we say, we like to get everybody vaccinated, for the flu. We probably have about 95% compliance with that. And the others have to wear masks. Well, now people are starting to wear masks. I'm a little worried that they're going to say, oh, I just won't get the flu shot. We need to make sure people try to keep, as much of a business as usual. And when it comes time for the regular vaccine, don't forget to get the regular flu vaccine either.
Mike Parrish asks, this is an interesting one here. How would you grade our community leaders, such as like commissioners, council members, as far as how they've been stressing social distancing, using face masks, etc.?
I guess, again, I'm sitting here thinking that I didn't realize I was going to come for a political, get on the political box. But they have been we've worked very closely with the commissioners. We've worked very closely both at the city level, at the county level. I know that they have, several concerns, but, of course, the thing that we've been supportive of, and I think that they've really tried to, embrace us as well as, we've had obviously the rallies and the demonstrations. They've been wanting to do that. And I think, again, they're faced with a really difficult challenge. And that difficult challenge is trying to somehow make sure we protect the health of everyone. But we can't have our economy, we can't have our business, we can't have our community come to a screeching halt. And I think that's the tough part that they have, is trying to balance both of those, knowing full well that this isn't something that, we're going to come to August and it's just going to go away, unfortunately. So I think, they've certainly been very committed to making sure that that we work together to try to take care of things. I think the Coastal District Department of Health, the Public Health Department, we have a call every Wednesday morning with Dr. Lawton Davis to talk about what's going on, and our county leaders, Alan Allers and Catherine Downs, they're on the phone with the folks from Camden, with the folks from McIntosh. Dr. Davis is familiar with really the entire region, and we talk about things like about access to public buildings and what's going on. So, they've really been very sensitive to it. They've been trying to be supportive of it, but we had some of the things that we've opened up to do, unfortunately, maybe make us rethink what we're doing. We had to test the entire Camden County High School football team and their coaches last Monday morning because a couple of the guys tested positive. Go figure. Out there, on a gridiron, and somehow you think you're going to not somehow pass along some heavy breathing, I guess, along the way. So it's tough, unfortunately.
Roland asks, is there an antibodies test readily available for our area?
That's a great question, too, because everybody, how many people who said, I'm sure I had it back in February? Well, we've done about, because the antibodies, but I've sort of learned some things along the way. The antibody tests for, there's a couple shortcomings about it. Number one, it tests for whether you have it, HAV as in Victor E, or had it, HAD as in Delta D, but it doesn't differentiate. So it can just tell you did you have it or did you have it? And do you have those antibodies? And the answer is yes. Then really, I don't know whether I have it right now or I had it months ago. So it doesn't differentiate between that. And it also takes almost 7 days before, if you do have it, it takes about 7 days for it to appear on the antibody test. So the antibody test is kind of that's nice to know, but it really is not a good tool to be able to diagnose somebody. And to be honest with you, we've had very limited use of it. We've had about 200 tests performed so far, and about 5% of those people tested positive with the antibodies. So again, I don't know if they had it or have it, but 5% of those. I think probably one of the measures we do, and we kind of report on this regularly, is before people have surgery, because we're doing elective surgery, and before people have surgery, we're testing people. We have about 35 or so, maybe 38 people out of around 3,500. So about a 1% positive rate just on people who feel that they have an elective case that they want to have done. And we want to be able to accommodate them because we don't want people putting off forever their health care. And I think that was one of the issues that people were worried about earlier on. I think we've seen that kind of recover. But that gives you a little bit of sense of just how pervasive it is in the community. About 1% of the people. And, again, Allison mentioned the 23 or 24, when you start to do the math on that and try to figure that out, it's probably not all that inconsistent with those kind of results that we're seeing in terms of the number of people. So that's about 2% of the people there. We're seeing about 1%. So I think throughout the community, there's probably a 1 to 2% spread right now.
All right. I think that is all the questions. And I thank you again so much for joining us this morning.
Well,
and
appreciate that. And I appreciate all of you who sit in for their Zoom meetings. I said I've had my fill of Zoom meetings already. I wish we could meet more often in person, but unfortunately, it's hard to find a room big enough to be able to provide the separation that we need. But please, I encourage you to continue to participate and continue to do the things you need to do to really kind of help keep our business and community moving forward, because our community has so much to offer, and it's just it's tough to put it under glass and not be able to see it. So
really, again, thank you. Thank you so
Allison.
much for joining us.
Thank you very much.
Thank you.
Allison.
Okay. We do have a gift for you here.
Remove your mic.
thank you very much.
You.
Appreciate it.
And enjoy that and have a great weekend.
Hey, you do the same thing. Thanks, everyone.
All right.
Thank you.
Thank you. Okay. That was great. And again, I just kind of feel like you just feel a little calmer when you have a little more information, and anyway, so we're going to go back to the agenda here. Committee reports and updates are going to be done via slideshow. We're going through those slides now. And I love this slide, the stronger together, even when we're apart. Okay, we had the nominating committee met earlier this month and have come up with the proposed slate of GIAR officers and directors for 2021. And we will be voting on this slate of officers at our September member meeting, which at this point looks like it may be held in the same format. But I will go down the list here for the officers. Elaine Culler-Marlotte, President for 2021. Angie Amar, President-elect. Rachel Fitzpatrick, VP of Admin and Finance. Sherry Gibbs, VP of Governmental Affairs. Erin Vaughn, VP of Professional Development. Sandra Branch, VP of Member and Public Services. And our directors, Lisa Ogden through 2021. Kate Pontello-Karwacki through 2021, Dana Gardner through 2022, Michael Heiser through 2022, Martin Sportschwetz through 2023, Allie Sweat through 2023. So congratulations to the nominees. We have Shop with a Realtor is going to be a little bit different this year. We've not been able to hold our traditional fundraising events that we normally have. And we're going to be asking for donations online to Shop with a Realtor. Visit GIAR's classy.org donation page to contribute. And I believe that the Community Relations Committee is going to be holding the Shop with a Realtor event a little bit later in the school year. Obviously, as we all know, the school year has been pushed to a little bit later in August, and I believe that the Community Relations Committee is considering shopping possibly in September or maybe a little. Yes, but we will definitely be doing something for that. And upcoming education courses. I don't. Oh, the script there. Oh, thank you. Bradley wanted me to describe all of these courses for you. We have client-centric training. Knock out the core course for the ABR designation and the SRS designation with Tom Gillette's client-centric training. This 4-day course gives you a broad understanding of working with clients, both buyers and sellers. And that will be held August 3rd and 4th. So that is coming up, and that would be a great opportunity to, well, it says it's a 4-day course. Oh, and on the 13th and 14th will be the second part of that, part 2. Okay, so that also, it's 24 hours continuing education credit, but it also satisfies for your new agents or their agents within the first year of their license, satisfy your 25-hour post-license requirement. So that's actually a great deal. The ABR portion is on 3rd and 4th. The SRS portion is on the 13th and 14th. And they are offering a hybrid class format. You can either take the class in person at the training center where we are today, or you can live stream from the Zoom virtual classroom and still get the CE credit. And the early bird registration ends this Sunday, and it's $450 for the in-person course or $300 for the live stream course. Our National Code of Ethics Day is August 11th, and we're going to be attending in a virtual classroom as realtors from all over the state participate in an interactive NAR Code of Ethics class with renowned instructor Lee Brown. It's $15 to register, and realtors who are in their first 6 months must take this course. Excuse me. It's great to talk in the mask like this. Excuse me. All right. And it looks like we have commercial real estate for beginners and veterans on August 31st and September 1st. Linda Olson continues her commercial series with deep dives into developing land and writing lot and land purchases and sale agreements. Linda's classes will only be available in the Zoom virtual classroom, and there will be no in-person instruction for either class. The Education Committee has been hard at work adding more classes for the fall and winter of 2020-2021. And to register for any of these classes currently scheduled, visit mygiar.com. The NAR Leadership Summit expands its invitation list. This is something that the NAR normally holds in August, and past association leadership can now attend the virtual summit from August 17th to 19th. And again, that's our national speakers. It's a great event. I attended it last year, and it was amazing. And it's great that they're able to, okay. I'm told them to get my mask off. Wow, all right, better. So, right, and all right, we have 2 MLS benefits, 2 new ones. Okay, I do, I have it right here. I told you this was not going to run exactly smoothly this first time around. I'm choking here and being coached at the same time. But anyway, this is very exciting. The MLS committee board of directors is proud to announce 2 new member benefits from the real estate data analytics firm Terradatum. The first is Ergo, is a market conditions indicator that takes all of our MLS data and transforms it into an interactive real-time map giving you insights into trends and helping you predict where the market may be headed. I sat in on a presentation of this, and it was really amazing. I mean, it goes block by block, almost a street view, and you can see kind of what is going on in certain neighborhoods. And so that would be that's going to be very helpful for our business, for our buyers and our sellers. And we also have Agent Metrics that analyzes market conditions and creates effective marketing materials to showcase your strengths in marketing, knowledge of market trends, and the ability to expertly price homes. So these are two new benefits as our member benefits, and we'll be rolling those out and having training on those, I'm assuming. And it starts today. Yeah, and it'll be running through next week. So it's good, and I think, how are we doing? Okay, we have had to cancel our awards banquet. As you know, we had an awards ceremony earlier this year, virtually, and the banquet itself was canceled for 2020, but we are going to we've rescheduled for Saturday, March 13th, 2021. Put it on your calendar. Hopefully, by that point, we're all able to meet in person. And party in person and wear all of the great roaring 20s costumes and garb that we were all preparing to wear earlier this year. Put that on your calendar. And I think that pretty much that pretty much is our updates and committee reports. All right, now for the fun stuff. I'm going to go into I think we're ready for the raffle. Today we're going to be raffling off two $50 gift cards. And as you can see, everybody who is attending this meeting is on this awesome wheel of fortune. I don't know if that's trademarked or not. But anyway, we are going to be raffling off two $50 gift cards. So let's start, let's roll the wheel for the first one. Donna Davis, congratulations. You are the first winner of a $50 gift card, and you'll be receiving that via email, and it will be an e-gift card. So we're doing everything virtually these days. All right, second roll of the wheel here, spin of the wheel, roll of the dice. Gary Norwood, congratulations. $50 gift certificate will be coming your way. All right. And do we want to do the PPE raffle? Okay. Okay. So we have two. Sorry about that. These are little packs of, it's a mask and a glove and some is that oh it's not okay, sorry. Okay. So anyway, we're still looking at the Wheel of Fortune here, but I'm holding up a Realtor branded personal protective equipment pack. It has a mask, it has a glove, and it looks like this is some sort of hand sanitizer. Yes. And this would be great to keep in your car as you go, just for an emergency backup kit if you need it. So we have two of these to give away today. We have five of these to get. We have five of these to give away. So we're 5 more spins of the wheel. All right, here we go. Looking for the wheel. Okay. All right, here we go. Roland Daniel. Congratulations.
able to
And I'll
deliver
deliver
that?
I'll deliver this especially, yes. Okay, the next one, number 2. Okay, Richard Rizzo, congratulations. And contact the board to arrange picking this up or delivery if we can do that. All right, number 3. Jake Hoffman, congratulations. All right, number 4. Ann Peck, congratulations. That's great. All right, number 5, the last one. Okay, here we go. Sandy Simmons, congratulations. And again, if you've won one of these, you can contact the board office and we can arrange to get these to you. All right, and we do have, and these are Realtor branded masks. And I did not wear one today because they're actually very light, which would be perfect in this hot weather. As you can see my R here. But the, you can't really talk that much in them just because the fabric is so light that it kind of jumps into your mouth while you're talking. So, but we do have these to give away here at the office while supplies last. So if you are interested in picking one up or having one sent to you, please give the board office a call. And the next, I'd like to just some announcements. The Georgia Association of Realtors annual conference, which was scheduled for Savannah, celebrating our 100th year, unfortunately had to be canceled for the in-person event, but they are going to be holding it virtually from September 8th through the 10th. And it is $25 to register. And again, you'll have amazing opportunities for continuing education credit and speakers and board of directors meetings and that sort of thing. So it'd still be a very worthwhile event to attend, even though it's not in person, but virtually. And again, you can sign up for that meeting at GARealtor.com. And again, same thing with the National Association of Realtors. They have also put their annual conference to be a virtual conference. And that will be in November. I mentioned earlier about the NAR Leadership Virtual Conference. That's August 17th to the 19th. And we are gearing up for 2021 and looking forward to an exciting year, a different year, and a better year, hopefully, than this one. And if you are interested in joining a committee, I ask you to look into which ones may be of interest to you and join today. Look at mygiar.com for more information there. Again, for those of you who have attended, thank you so much. We have recorded this meeting. We've recorded my conversation with Mr. Scherneck. So if you've got colleagues that couldn't attend this morning, I know we're all really busy. Please let them know that they'll be able to watch this again. And please check your email after this meeting for a thank you gift. And we will be hosting our September membership meeting via Zoom on September 25th. And that is the annual meeting and our vote meeting. So voting for the slate of officers. So that will be an important one to attend and sign up for. So it is a little bit after 11 o'clock. I thank you again for attending
And have a great weekend, everybody. And goodbye.